Hello, I'm Dr. Jen McWilliams for the Joint Telepsychiatry Toolkit of the American Psychiatric Association and the American Academy of Child and Adolescent Psychiatry. I'll be discussing utilization of the team-based models of care in the practice of telepsychiatry with children and adolescents. The concept of team-based care was introduced in 1968 by the American Academy of Pediatrics as the medical home model to coordinate with the care of children with chronic conditions. The concept has now been accepted across medical disciplines with a focus on team-based care. The Agency for Healthcare Research and Quality has delineated 5 components to patient-centered quality medical homes: comprehensive care, patient-centered care, coordinated care, accessible services, and quality and safety improvement in services. The patient-centered medical home model has particular relevance to delivering psychiatric services in pediatrics given the shortage of child and adolescent psychiatrists, especially in many rural and poverty-stricken areas. While the patient-centered medical home model and its implementation through telepsychiatry is still in the early stages of development, the core features of team-based models of care have been well described. There are 3 main primary models of team-based care between child and adolescent psychiatry and primary care: direct telepsychiatry service models, teleconsultation models, and telecollaborative care models. In a direct telepsychiatry service model of care, child and adolescent telepsychiatrists perform an initial evaluation of a youth who is at the patient or originating site and conduct ongoing sessions to manage the patient's treatment needs. They may coordinate care with other team members, such as case managers and the primary care provider. This direct service model redistributes care to youth who don't have ready access to services, but does not necessarily expand the scarce resources to more children and adolescents. This team-based approach addresses 2 requirements of the patient-centered medical homes, including more accessible and higher quality of care. It often falls short of comprehensive and coordinated care, however. In the teleconsultation models, telepsychiatrists conduct an initial evaluation after which they consult with a primary care provider regarding ongoing treatment recommendations, usually summarized in a concise report. As the psychiatrist does not deliver ongoing care but assists the primary care provider, the teleconsultation model of care allows greater utilization of the child and adolescent psychiatry resource across more sites and more youth, addressing the issue of workforce shortage. It also helps to strengthen the skills of the primary care provider in caring for the mental health needs of their patients. The teleconsultation model addresses several requirements of the patient-centered medical home model in providing accessible, patient-centered care with improved quality of care as well as coordination of care. The telecollaborative care model most closely resembles the Agency for Healthcare Research and Quality's definition of a patient-centered medical home. In this model, psychiatrists collaborate with primary care providers, providing weekly supervision to an on-site care manager who acts as a liaison between the telepsychiatrist and the primary care provider. The care manager administers screening tools, tracks treatment response through a patient registry, ensures adequate follow-up, intervenes in the case of medication noncompliance, and refers patients with complex needs to a specialist for additional evaluation. Overall decision-making and treatment remain within the primary care provider's scope. While this model is gaining credibility in traditional clinic practice with adults, research on implementing this model through telepsychiatry is just starting. One recent study found the model to be effective with improving outcomes for children with ADHD, but the psychiatrist was not collaborating through video teleconferencing. The next step is to test this model through video collaboration. Telepsychiatry can be a great asset in the collaboration of care model because many primary care clinics don't have access to a local psychiatrist with whom to collaborate. This model facilitates the patient-centered medical home components of accessible, patient-centered care and quality of care with variability and coordination. Ultimately, the success of implementing these team-based models of care through telepsychiatry with youth depends on the ability to build strong working relationships between the child and adolescent psychiatrists and primary care providers, and to establish shared goals for working with their young patients. When initiating team-based models through telepsychiatry, team members will need to determine the need for a contract or memorandum of understanding between the sites, review credentialing requirements at the patient site, clarify the roles for the telepsychiatrist in emergency management, and determine procedures for documentation and sharing of clinical information. Team-based telepsychiatry models of care offer many benefits. The burden of care is spread across the primary care provider, child and adolescent psychiatrist, and other specialists, while increasing the primary care provider's confidence in treating common childhood psychiatric disorders. With increasing coordination, quality of care also improves. Team-based telepsychiatry models of care have the potential to respond to the evolving population healthcare mandates for children and adolescents. I'm Dr. Jen McWilliams for the Telepsychiatry Toolkit. Thank you for watching.